says the industrial produced items that are ready to eat contain little or no whole foods and make up over 50% of the average American's diet. And that's what's crazy about this when you start looking at it, how often now people are consuming this stuff. And it's causing such an imbalance because it's like, okay, yeah, I always try to go off the 80-20 world diet. If you eat pretty clean about 80% of the time, you'll stay in pretty good shape. Stay pretty good as far as overall. 20%, you want to have a burger sometimes or something fun like that. Okay, cool. But eating this stuff on a regular basis is really linking to all types of issues. It says the 2021 study also noted that high consumption of UPFs associated with various health issues, including heart disease, obesity, diabetes, cancer, depression, further adding to the growing body of evidence that UPFs are harming public health.
Well, we talked a minute ago about elevated insulin levels. That's called Syndrome X. And when you have Syndrome X, what ends up happening is the body has elevated insulin like all of the time. And so you're constantly storing the sugar as body fat. And there's another hormone the body releases called glucagon, and it helps the body to release the stored body fat and burn it for fuel. The problem is with elevated insulin, it's like stepping on the gas and the brake at the same time. Your body doesn't release glucagon. It simply doesn't do it. So your body's constantly storing fat. That's why so many people are having health problems and weight problems and diabetes problems. That's why so many people have become overweight. That's why so many people are carrying so much internal fat. I mean, it's amazing to me how many people that I see on a regular basis that really eat horribly. It really is. I mean, you start looking at a restaurant. The other day I was at a birthday party, and a lady was there, and a great lady, very nice. And all of a sudden I looked at her pasta that she's eating. She had a giant plate of pasta. She weighed about 350 pounds. And I thought, well, she's going to just keep gaining more and more weight because her elevated carbohydrates are going to increase elevated glucose, and her body's going to continue to produce insulin and not release glucagon. And her husband was also very overweight. You think, well, this is awful. And they're really, really nice people. They are. And then the husband was having problems with seizures because he was basically, I believe, drinking diet sodas. And so you think about it for a second. If you know that diet sodas are going to cause seizures and headaches and optic nerve degradation because they contain phenylalanine, aspartic acid, and methanol, which is what's in aspartame. I did a whole article on it. It's called Aspartame, A Chronicle of Crime. You can read it on the Health Masters website or the Team Health Masters website. And the reality is that when you have a product like that that's causing so many health issues, it messes up blood sugar regulation, makes you want to crave more carbohydrates. So you shouldn't be drinking diet sodas at all.